Hello and welcome. This is Dr. GERARD CUOMO. I want to wish everybody a very happy and healthy 2013. We're working on tooth number 2 today. Right next door on number 3 we have an Emax crown. We're going to duplicate that. So we'll start off, patient's numb. We've got a rubber dam in place, as you can see. Got an old amalgam that's going to come out, and so we'll go ahead and get started. Um, I'm going to go ahead with the 330 burr. And let me have one more, please. 330, fresh 330, please. Okay, so we're going to go ahead. We know that the depth of the 330 burr, it's a friction grip carbide, is 2 millimeters. So knowing that, I can judge our depth of our cut. Now, this is quite a large amalgam, so you're going to see a lot of alloy come out. We've already taken our bite alginate. No, yep. Okay, I'm going to zoom in. And you can see the area of decay. There's actually a crack there and also tooth decay. How you doing? Okay? Ready? Yep, everything's good. All right. So first things first, I'm going to get right through the contact area. And there's the depth of the alloy now, so you can see that. You also see the decay underneath. We went through the contact area without touching the adjacent tooth. The whole object of the game is to have enough visual that you can see. Now I use a microscope, uh, and it does make the difference as far as what you can see and avoiding nicking the adjacent tooth. So now I'm going to go ahead and just trace, literally just trace out the amalgam. And we know the depth of the spur is 2 millimeters. Good size alloy on a second molar. Alright, and we notice there's a little white liner underneath it, so we'll put one back ourselves. And just take my time. There's our white liner. Now I go down to the distal buccal. So basically this is just an exercise and just going nice and slow. And if you see a liner, you can just take it right down to that liner. Alright. Now you can see now it's all going to come out in one piece. So I'm going to grab a cotton plier. And there's the alloy. And we'll transfer this on over. Okay, and now what you see underneath is a decal, basically. Now before you rinse that Explorer, and we're also going to check for cracks underneath. That's still a little bit more, but see how this just flakes out? That's the old decal, the old technology. We're just going to get rid of that. See, it just never really even hardens. It's a real, very, very clay-like material. We use it, used to use it quite often for placing temporaries. I don't even do that anymore. I use Duralon cement. So it really doesn't even have a place in my practice anymore. Similarly to IRM, anything with eugenol, no longer in my practice. Okay, so we know we've got a depth of about 2 millimeters, so we'll take it down to almost 2 mils. I'm checking for a crack. I might see one. Let me just see. Not quite. So before I do that, I'm going to take a round burr and with some water now and just go through a little vibration, a little more, you know. Now I'm pushing fairly hard with a number, this is a number 6 round burr. I like to buy stainless steel round burrs because they're not overly aggressive. As you're getting close, and you're in the dentin, you're getting close to the pulp chamber. You don't want to remove anything unnecessary. So that's why I like stainless steel. Yes. Don't mix it yet, though. I'm just cleaning out the decay. Keep rinsing. Alrighty. So now what I'm going to do is take a flat end diamond. Thank you, Gail. Flat end diamond. I'm going to come in and just score the inside surface just to take away any of the remnants of the old material. Clean it up, in other words. Get a nice new surface of new dentin. And I'm just going to notch about where I want to be with my prep. So my core buildup material will go to that notch. So I'm just going to notch it in. This is right about there. Yeah. Perfect. Good. Cavity cleanser. So now I'm just going to go ahead and cleanse this. Perfect. With a pre-comp syringe. Okay. Alright, that looks better. Rinse that again. Now I'm going to use an air syringe. It absolutely has no water hooked up to it, and also has 2 or 3 filters. I always make sure of that. I don't want any contaminants at this point. I'm going to lower our light. Let's see. Here it is. And now, where would you want to place the Vitribond? I like to place it in this area here. I like to go in here, place a thin amount. Just where the chamber would be. But because she's just super sensitive with this tooth, I'll make sure we get a nice blanket. Not too thick though, but we'll cure it. As we cure it, we'll add a little air just to keep the tooth cool. Alright, so here we go. And we'll take some more. As the first, I'm using a periodontal probe to get it down into some spots. I appreciate everyone that's been subscribing to my channel and also following the views and asking some great questions too. I really appreciate the great input. We hope that we are able to connect with a lot of offices and students and patients across the Atlantic and Pacific. Alright, so I'm going to go ahead and cure that. We'll blow a little air, lightly blow some air. I'm going to keep her tooth nice and comfortable. Here we go. I'll cure for 20 seconds. Got an LED that we're using. And love this new bonding light. There's several new ones out now. Hyperclar just put one out. That's small, cordless, Ultradent as well. This one happens to be from Dent Supply. Okay, now we're going to go ahead and apply our Paracore etch. And we'll lubricate, just make sure I cover everything with that. This system has its own etch, and it does not get rinsed. This is just, it gets etched, and then we just air dry it, put the bonding agent on, lightly air dry that. Does a great job of desensitizing teeth. We have a lot less root canals that we have to worry about in our practice because of the use of the microscope. We just don't have as much trauma, and we move things right along pretty quickly. I would say about 50 minutes to a crown prep. After you get the buildup in there, if you're working with 6 hands, great. If you're not, well, try to, if you can. It helps when you got a second assistant that's helping out. And bonding agents in place. We're just adapting that nicely to the dentin, working it into the dentin. And then we'll just lightly air dry that, get it off of all surfaces. There we go. And now I'm just going to this in place. All right. Explorer. Okay, bonding light. Light cure for 40. And we'll just lightly dry that. Oh, it's curing really super light. Actually going to add a little bit to this. Uh-huh, yeah. See a little void I want to fill. Let's see if that squeezes out. We'll add just a little bit more. Alrighty, cure that. Okay, so we're going to prep to as far as we can with the rubber dam, and then obviously we got to take the dam off to finish our prep and to get it perfect. So let's go ahead with that. I'm going to go right to a ball diamond, as I just want to get some gross reduction done first. Bring my light up again. Ball diamond. And just try to keep everything rounded. Labs like that when everything's kept rounded. So okay, so we'll come in here, ball diamond. And we'll go ahead and reduce our cost. So that little internal line that I made when I was cleaning up the prep, that's what I'm prepping to. So it's nice to have a little place to follow. And the diameter of this ball is exactly 2 millimeters, so you don't lose your bearings. So it's a lot easier to prep this far back in the mouth with a ball diamond. Now I'm going to come across the palatal. How you doing, Maria? Good? All right, she's doing great. Follow from the central groove. Okay. So do a gross reduction with that. Now I'm going to switch to a longer burr now. I'm just going to go with like a tapered diamond, a flat end tapered diamond. Alright, and that's the idea, is to come in from the side if we can. If we can't, then we'll take the dam off. So okay, and reverse that. Water on the mirror. And dry the mirror. Okay, so here it's impossible to prep this with the clamp in the way, so we'll get the clamp out. So what I'm going to do is I'll finish the interproximal area. And let's start on the lingual. And we'll prep that. Okay. Dry the tooth? Okay. I like the flat end taper for just really creating the line of the margin. You can do that first, and then you can chamfer that in. I'll pick up the mesial. Alright. Okay, we're gonna pick this up again. I'm gonna finish a little bit more here, and then we'll take the rubber dam off. Yeah, we're on our way over to checking hygiene. Maybe give our patient a little bit of a break. Cotton pliers. Another pair of cotton pliers. Hemostat. All right. Yeah. Okay, great. Hemostat's ready. I'm gonna get that out first. That's the tether floss that I use. Pop this out. And we'll give her a thorough rinse. And when I come back, we'll place our cord. See you next time. Thanks for watching.